In health news today, we are starting a 6-part series on mammograms. They are one of the most important screenings a woman can get, but many are afraid or even complacent about getting one. Breast cancer is the most common form of cancer in the U.S., and early detection from mammograms is key. And Dr. Denise Reddy is here. She's going to help us from the get-go. Thanks so much for coming on.
Thank you for having me.
Let's start on when women should start getting mammograms. I feel like lately we've heard different things.
There has been some controversy in the news that you've been hearing, but the recommendation is for women to get a mammogram every year, beginning at the age of 40. And this is in line with several societies like the American Medical Association, the American College of Radiology, the National Cancer Institute. Part of where the controversy started is the U.S. Preventative Task Force recently issued a statement questioning the value of mammograms and saying that women should get mammograms at the age of 50 every other year. But they did concede that there is some value for women who are at high risk and have in their 40s, they should consider getting a mammogram. So it's really important for you to talk to your doctor about what's the best screening plan for you.
You can't go wrong.
Absolutely.
Really, right? That's how I look at it. So those are the current guidelines. We got that covered. What should I bear in mind as I research where to get a mammogram?
Okay. So it's really important that you find a facility that's been accredited by the American College of Radiology. And the reason why that's important, it tells you that the radiologists and the technologists there are specially trained, that the equipment is adequate, and that they've passed routine inspections. This is much more important than the location of the facility. And you also want to look into who's going to be reading your mammogram and make sure that it's a radiologist who specializes in breast imaging.
All right, and let's talk about what type of mammograms there are. The 3D mammogram, I've been hearing a lot about that.
Right, so another name for the 3D mammogram is breast tomosynthesis. And this is a new technology that's trying to help us solve the problem of seeing through that overlapping dense tissue that occurs on a regular mammogram. And how this does this is the camera swings in an arc and it takes pictures at different angles. And then from these pictures, we're able to have a 3D picture of the breast. And where it's really advantageous is it helps decrease the callbacks or the times patients have to come back for additional imaging. And some studies have even shown that it increases cancer detection.
Yeah, we're looking at a photo right now. What is your radiologist going to look for?
So when I'm looking at a mammogram, I'm looking for several things. One of the things I'm looking for are calcifications, and those are little mineral deposits that almost look like little grains of salt sprinkled in an area on the mammogram. We also look for masses, and we look at the shape and the margins of those masses. Are they smooth or irregular? We also look for asymmetry, so something you see in one breast but you're not seeing in the other. And it's also really important for us to have comparison exams because it helps us look for subtle changes from year to year.
How should we prepare for a mammogram, and how do we schedule it?
So preparing for mammogram is relatively easy. You just need to make sure you don't wear deodorant or perfume or any powders that might cause an artifact on the exam. Sometimes women who have sensitive breasts may want to time the exam for a time during their cycle where their breasts are a little bit less sensitive. As far as the scheduling goes, you need an order from your doctor, and that at our facility you can either call for an appointment, or we're really excited about the online scheduling that we have now. It makes it easy. You can do it at any time that's convenient for you. It's one less barrier for scheduling a mammogram. And as you mentioned before, the more women who get screened, the more early cancers we detect and the more lives we can save.
Yeah, it's so important. And a lot of people are nervous or just say, oh, I'll do it next week. You say, don't do that.
Do it now.
Right now.
Don't
you
wait.
can schedule it online. It's super easy.
Absolutely.
Okay, you're going to take me through mine, right?
Yes.
Okay, so next week we'll kind of go through all of these steps we talked about when I get my mammogram.
Right.
All right. Well, thank you so much for all of your help. For more information to schedule your mammogram, you can do it online. It's super easy. It's eSmile. That's ESMIL.com. Or you can also call the number on your screen. And coming up in our series, I go through the journey, again, of getting a mammogram, and we answer your questions. If you have anything you would like to get answered, go to smilquestions.azcentral.com to submit them.